Since 1998, I started radiosurgery in New Delhi, and because at that time nobody was interested in treating these lethal tumors, we tried to start treatment of gliomas with gamma knife. What we found by our short study between 1998 and 2004, all patients from pilocytic astrocytoma to grade 2 glioma did well after radiosurgery, while all the tumors which are grade 3 or higher have an average survival of 10 months. So what we found is that the patients with these two groups are absolutely different. Now, one thing is very strange in this group is that most of the patients we treated with malignant glioma have already been given prior radiotherapy. We found there is recurrence in all these tumors even after radiosurgery, and these tumors does not do well. Over years, we have found and studied the various research papers in the basic science, and we have found that there are many phenomena which is happening in these tumors. The glioblastomas are high-grade malignant tumors with rapidly dividing tissue. But it has been found that if you give standard fractionated radiotherapy, slowly these tumor cells convert into clonogenic cells and they migrate from the target area where the radiotherapy is planned and being given for 45 days. So many of these cells escape the main radiation focus and go to the surrounding structures where they form nest and they form recurrent tumor. Usually recurrence is found within 2 centimeters of the periphery of the tumor, which is marked on MRI and CT scan. So scientists do a lot of research and they find out many reasons why tumor recurs. If we look at the radiobiology, as soon as radiation is given, many phenomena happen inside the tumor cells. There are something called EGFR and other factors which develop when a low dose multiple fractionated radiation is given to the tumor. The function of these chemicals is to support the DNA which is damaged by the radiation, and that's why they convert into clonogenic cells and also tend to survive, which lead to recurrence of the tumor. While when we give a single large fraction, tumor does not get time to make these chemicals which are repairing the DNA. At the same time, many lethal chemicals like ceramides develop which damage the tissue much more extensively as compared to fractionated radiation. So we started doing many malignant tumors, and we have treated tumors with many malignant indications like glioblastoma, oligodendrogliomas, malignant ependymomas, and we have found that some of these tumors do very well. We are not saying that radiosurgery can replace whole treatment of these tumors, but definitely we can give good survival. Today we are treating a patient of glioblastoma which was diagnosed in 2014. She was operated and partial decompression of tumor was done. The patient was advised radiotherapy with a very poor prognosis. So they approached me again and they wanted me to find a solution. I suggested to do radiosurgery, and what we find is the tumor get controlled. After 1 year, a radiation necrosis is developed on that site. So patient was operated again, and then patient continued to be okay without any new recurrence in that region. But after 1 year, small recurrence was seen in the tumor region in perfusion MRI. So we did the treatment again. After the treatment till now, 9 years have passed and there is no recurrence in that tumor in that region. However, very recently we have found that away from that tumor, much away into temporal lobe, we have found a small tumor coming up, which also have same per high perfusion, high spectroscopy picture showing it's a highly grade malignant tumor. So we have planned radiosurgery today for this tumor. That why we are doing this? Standard radiotherapy has been done for more than 100 years for these tumors, but still it has not come to any conclusion. So we can try something new and try to do or give better hope to these patients. If you do a whole brain radiation and or a wide border standard radiotherapy, you cannot repeat this radiation again and again. But radiosurgery is such a technique that we can repeat the radiation again without damaging the surrounding brain. And that's why we have found the patient is fully preserved cognitively, and also there is no deficit in his walking and motor sensory areas. So we have now able to conclude that yes, we can give a better time to these patients who are dying of these malignant tumors, and still they make them feel more happy and controlling that last phase of their life. Thank you.